Well, hey, we're doing NCLEX questions today for both RNs and LPNs. Make sure you guys like, share, follow. We're going to jump into these questions right now. Hey, so here we go. Question number 1. The nurse is providing discharge teaching for a client with leukemia. The client should be told to avoid what? Using oil or cream based soaps, flossing between the teeth, the intake of salt, or using an electric razor. What are we thinking? And our answer is B, flossing between the teeth. The client who is immune suppressed and has a bone marrow suppression should be taught to not floss between the teeth because platelets are decreased. Why? Because they have a bleeding issue now. That's part of health promotion and maintenance, which is 6 to 12% on the NCLEX exam. Electric razor is safer than the blade. You are correct. Why? Because they are on a bleeding precaution. Absolutely. So shout out to everybody that got that right. Hey, if you didn't get it right, circle back, get the content, keep doing your questions and your answers, and you need your rationale so you can retain and remember that information. So shout out to y'all. All right, here we go. Question number 2. The nurse is changing the ties of the client with a tracheostomy. All right. The safest method of changing the tracheostomy ties is to what? Do I want to apply the new ties before removing the old one? Have a helper available? Hold the tracheostomy with the non-dominant hand while removing the old tie, or ask the doctor to suture the tracheostomy in place. What are we thinking? The answer is A, apply the new tie before removing the old one. All right. Leaving the old one in place will secure the clean ties, prevents inadvertent dislodgement of the tracheostomy tube. That is part of reduction of risk potential. Reduction of risk potential, all right, which is 9 to 15% on the NCLEX, making it, that's the 4th largest section on the NCLEX exam. Here we go. Question number 3. The nurse is monitoring a client following a lung resection. The hourly output from the chest tube is 300 mLs. The nurse should give priority to what? Turning the client to the left side, milking the tube to ensure patency, slowing the IV infusion, or notifying the physician. What are we thinking? Notifying the physician is the answer, which is choice D. The output of 300 mLs is indicative of hemorrhage and should be reported immediately. That is reduction of risk potential. Reduction of risk potential, which is 9 to 15% on the NCLEX exam. All right. Question number 4. The infant is admitted to the unit with tetralogy of Fallot. The nurse would anticipate an order for which medication? All right. So first of all, let's talk about what is tetralogy of Fallot, right? Once I understand what that is, what other congenital issues happen within that? What does it consist of? All right. Once you figure out what it is, what medication is best used for it? Is it DIG, epinephrine, amiophylline, or atropine? What are we thinking? The answer is A. It is digoxin. All right. The infant of tetralogy of Fallot involves 4 heart defects: a large ventricular septal defect, pulmonary stenosis, right ventricular hypertrophy, or an overriding aorta. He will be treated with digoxin to slow and strengthen the heart. That is part of pharmacological and parenteral therapies, which is the 2nd largest section on the NCLEX at 13 to 19%. All right. For question number 5, the nurse is educating the ladies club on a self-breast exam. The nurse is aware that most malignant breast masses occur in the tail of Spence. On the diagram below, select where the tail of Spence is. Is it A, which looks like it's in the axilla, and then you got B in the areola area, above the areola, which is D, and then below it is C. So what are we thinking? Everybody, y'all tell me. Where does it start? Where does it occur? A most aware spot. The answer is A. The tail of Spence is located in the outer quadrant of the breast. All right. Health promotions and maintenance. Right. So, hey, we tell ladies, hey, make sure you guys do self-breast exams, because the earlier you catch it and it's detected, the earlier that we can do something about it. All right.